Good morning, everyone. Thank you so much for joining us. I'm Erica Hartquist, Public Information Officer with the Oregon Health Authority. Today, we are hosting our monthly Zoom media briefing to discuss the latest on COVID-19 and the other respiratory illnesses impacting our state. Joining us today is Dr. Dean Sidelinger, Health Officer and State Epidemiologist with OHA. This is a friendly reminder to please mute your audio and use the raise your hand function if you have a question, and then I will add you to the queue. Also, we do have ASL interpreters on this call today, and everyone would greatly appreciate it if you spoke slowly when asking your question. This is an opportunity for members of the media to ask your questions and to hear from our expert. The public is encouraged to ask questions during our Facebook Live events. And also a YouTube link will be provided after this news conference wraps up. Okay, let's get started. Dr. Sidelinger.
Thank you, Erica. Good morning. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist with the Oregon Health Authority. Thank you for joining us. As we begin 2023, I am hopeful for the situation we are facing. As we did during December's monthly COVID-19 media briefing, I will share what we know about the status of the 3 respiratory viruses we've been watching closely over the past few months, including RSV, influenza, and, of course, COVID-19. I will also provide a brief update on Mpox, or monkeypox virus. For everyone who is sick or caring for a child or loved one, my thoughts are with you. We are still seeing Oregonians get sick every day. I want to thank again the healthcare partners from Providence, OHSU, and Legacy who joined our December briefing to help us get the word out about preventing respiratory virus transmission over the holidays. People heard directly from these experts about the strain hospitals were under and why we needed to keep loved ones at risk of severe illness, especially young children, safe and healthy. I also want to thank everyone in Oregon who took these experts' advice and wore masks, kept their distance from others, avoided gatherings, and got their flu and COVID shots to reduce transmission. I know many of you made the tough decision to postpone or limit the family get-together or forgo that holiday concert or play. Please know our public health and healthcare partners appreciate your sacrifice. These measures help limit transmission during the holidays, and I have promising news to share. While overall respiratory virus activity in our communities remains high, and our hospital systems are still under extraordinary pressure, with some operating near or even above 100% capacity, we are seeing some improvements in respiratory virus hospitalizations. Unfortunately, our hospitals are not yet able to resume their normal workflows. RSV was the first respiratory virus surge we experienced, and thankfully, it has improved the most. We are well past the peak of RSV in children, which occurred on November 19th, and hospitalizations are decreasing rapidly. This is very important for pediatric hospital capacity because RSV causes severe disease mostly in young children, although it can also affect the elderly. Influenza activity remains high in both adults and children. We are past the peak of the season in adults, which occurred on December 3rd, but hospitalizations in children have largely plateaued and are only just beginning to decrease. We believe that adult influenza will continue to decline and that cases amongst children will begin to decrease more rapidly soon as well. COVID-19 related hospitalizations increased quickly in November and remain higher than their previous baseline, but have dropped in the last week. National forecasts are predicting that COVID-19 hospitalizations will remain at their current level for the next few weeks. Dr. Peter Graven and his OHSU modeling team, in their statewide forecast published January 6th, are predicting a small increase in the number of people hospitalized with COVID-19 into February, caused by the highly contagious COVID-19 Omicron variant known as XBB.1.5. The forecast anticipates 367 people will be hospitalized with COVID-19 in Oregon as of February 4th, up from 342 reported on OHA data dashboards January 4th. OHA and its healthcare and local public health partners are keeping an eye on the new XBB.1.5 Omicron subvariant that is spreading rapidly in the northeastern United States as it outcompetes other variants, including BA.5 and BQ.1. XBB.1.5 is not yet widespread in Oregon. Our genomic surveillance last detected XBB.1.5 in mid-December, when it comprised less than 5% of all variants circulating. However, we do expect rapid XBB.1.5 growth in the coming weeks and are monitoring sequencing data closely. While this variant does appear to be the most transmissible COVID-19 variant so far, at this time, there is no evidence that it is associated with more severe COVID-19 infection. In general, we are not seeing a significant cause for concern about XBB.1.5 right now. Variants are expected to emerge over time, and there is no evidence that this variant is more harmful than the currently circulating Omicron subvariants. Bivalent boosters do provide protection against this subvariant and other Omicron subvariants, including BA.2.75, from which XBB.1.5 is derived. So how can you protect yourself? Even though we're seeing signs of improvement in respiratory virus activity, we need to keep up our efforts to protect ourselves and our loved ones from RSV, influenza, and COVID-19. First, it's never too late to get a flu shot. As I said earlier, flu activity remains high, and hospitalizations amongst children have mostly leveled off, but haven't begun to significantly decrease. There's always the possibility of a second influenza wave, and the flu shot this year is very well matched to the circulating virus. Second, get your COVID-19 booster, and if you haven't yet gotten the first 2 primary doses, please do so. It's the best way to protect you as the highly contagious XBB.1.5 variant makes its way toward Oregon. It will get here eventually, and we want you to be ready. Then, of course, there are those tried and true measures that our healthcare partners reminded you of last month. Wear a mask indoors whenever you can. Consider limiting large indoor social gatherings. Practice respiratory etiquette like covering coughs and sneezes. Wash your hands, and stay home if you're sick. Every one of us has a role to play in slowing the spread of these viruses as we go through winter, and that will help our healthcare system ensure that hospital beds are available for those who need them most. I'd now like to provide a quick update on Mpox in Oregon. As we previously reported, while we did see a brief uptick in Mpox cases in late October, they have dropped dramatically following the peak we saw in early August. The 10 to 15 Mpox cases diagnosed per week during the height of the outbreak have once again returned to a trickle. Before a brief spike in October, newly diagnosed cases dropped to just 2 to 3 cases per week. We are now seeing fewer than 5 cases diagnosed in the past month. As a result, we are shifting our reporting cadence on our Mpox website and data dashboards from weekly to monthly. This means we're also updating of the demographics dashboard to every other month. We believe these low case counts reflect what we have seen over the last several months and where we are focusing our efforts. Preliminary vaccine effectiveness data indicate that the Jynneos vaccine is effective against Mpox. 2 doses of the vaccine offer the best protection for those at greatest risk. Healthcare providers can and should integrate the Jynneos Mpox vaccine into routine health maintenance. We are asking providers to recommend and provide Jynneos to patients who are testing for HIV, STI, starting or continuing on pre-exposure prophylaxis or PrEP for HIV, living with HIV, and to transgender and non-binary patients. All told, Oregon has seen 270 cases of Mpox, including 268 adults and 2 children, since the start of the outbreak in early June, with 12 counties reporting cases. We are not quite ready to declare victory against Mpox, as we expect to keep seeing a handful of cases over the coming months, but we are in a much better place than we were in August and October, and we will continue to work with our partners to promote testing and vaccination amongst those at risk for infection. We are moving into our 4th year battling COVID-19. We're all tired, and we want to move on without thinking about the infections that are facing us. We still have loved ones and neighbors who are getting sick. Let's all take some steps to keep ourselves, our kids, and our loved ones safe. With that, I'm happy to take your questions.
Great, thank you, Dr. Sidelinger. We do not have any hands raised right now, so we'll give it a minute. I also want to remind our media partners that it's really helpful if next to your name you put your media affiliation so we know who you are and what organization you're with. So we do have our first question. Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. So my question is about the wastewater monitoring dashboard on OHA's page. My understanding is that this was intended as like an early warning system about rising COVID cases in different parts of the state, but some of the data is weeks old, including centers where there's supposed to be a sustained increase, but it's like multiple weeks old. So how is this going to be used or useful for the public as an early warning system?
Thank you, Fedor. Yeah, you're right that we do see some data lag in reporting on our wastewater dashboard, so it doesn't serve as early a warning as we would like. We can still use the wastewater dashboard to monitor trends, and it can show trends in overall disease incidence over time, as well as allow us to pick up evidence of variance over time. So it does still serve a useful purpose, even with the lag, but there are multiple steps between collecting the data, transporting those specimens to specialized labs, getting those results run and putting them on the website, which do kind of hinder its ability to really serve as that canary in the coal mine, so to speak.
Got it. Okay. And what is it that the data that OHA doesn't have the data, or that it takes as long as 3 weeks to post it, depending on the monitoring site?
I think, because of the multiple steps involved, that getting the specimens from our wastewater treatment facilities, which is often done by the facilities, getting those specimens transported to the appropriate lab, running the specimens through the lab, interpreting the specimens and being able to report that, and then taking that data to the website takes steps. There's not data that we sit on and wait to post. We do try and run it through that process, but it is quite a lengthy process, and some sites can be more delayed than others.
Got it. Okay, thank you.
Thank you for that question. Our next question comes from Elise Haas with Coin 6 News. Go ahead, Elise.
Thank you so much, Erica. So I've been in touch with some of the hospitals this morning, and they told me that the Portland metro area hospitals, including Dornbecker and the adult side of OHSU, are continuing to operate under the staffing crisis standards of care. So the adult and pediatric emergency rooms and ICUs, they tell me, are full. So at this point, they're continuing to care for patients in designated overflow spaces, including the hallway beds, enclosed semi-private rooms. Some nurses have told me just how difficult and exhausting it is right now. So I was just wondering what OHA is doing to support those hospitals that are at or near capacity.
Thank you for that question. Yes, our healthcare partners, the nurses, respiratory therapists, physicians, and other staff working in these settings are extremely exhausted. There's the long-term, like over the last 3 years, effects of combating COVID-19, along with this acute last couple of months hard work of caring for people with COVID-19, flu, and RSV. Staff members are getting sick, as are more Oregonians, and so that puts a strain on folks. OHA, in working with our healthcare partners, is continuing to bring in additional staffing resources from out of state and splitting the cost with our hospital partners to provide that staffing. We are streamlining processes so that healthcare providers from out of state or recently retired healthcare providers who have let their licenses lapse can be licensed and able to work in these settings much more quickly than previous. And again, with the crisis standards of care, that allows our hospitals to provide care in places that are usually designated as healthcare settings. anyone who's had to seek care in the emergency room knows the long waits that we're still experiencing. And so that's why I want to remind people that we all have steps that we can do to keep ourselves healthy, but also to help support our healthcare partners. Being up to date with your COVID vaccines, getting your flu shot this year, wearing a mask when you're in crowded places, and considering changing your gatherings and activities over the next few weeks while COVID-19 is circulating, continuing to circulate at a high rate, and flu is still circulating at a fairly high rate, can help keep you healthy and keep you out of the hospital. But we'll continue to provide regular calls and updates, work on staffing solutions together, continue to distribute oseltamivir or Tamiflu that we received from the Strategic National Stockpile to our hospital and healthcare partners who've been unable to get that for their patients, and working together, we will get through this. But they are tough times right now in hospitals, and they are providing care in ways that they don't want to, but they are still able to provide care for all those who are seeking care.
Thank you for that question. Our next question comes from Brandon Cameraman, I hope I've said that correctly, from KBEL. Go ahead, Brandon.
All right, thank you. Yes, cameraman. I want to actually piggyback off that question from Coin there. Is there anything OHA has learned from maybe the most difficult times of the pandemic and the impact it had on health professionals to now when we do see hospitals still, approaching the brink or maybe over the brink, that you can learn from those instances that could help now?
I think what we've seen is that the structure we have in place with bringing our regional healthcare partners together and having conversations about what are the needs that they're facing and what are the resources that resource needs that they have immediately have helped, and that served us well throughout this pandemic. But I want to pause for a moment and remind folks of what our hospital partners are facing right now. There's the acute issues that they're facing right now with flu, COVID-19, and RSV to a lesser extent circulating in our community. That not only makes individual Oregonians sick, it makes our healthcare providers sick. So we have more people seeking care in the short term and less people available to provide that care because we have staff that are out sick. That's on top of a 3-year-long response to COVID-19 that has had our healthcare providers working often longer hours and providing care for more patients with respiratory disease than they typically do and in previous years. So those two things together have created some unprecedented situations. I think what we've learned is that, similar to bad flu seasons, that when we see spikes of respiratory diseases, we know that hospitals are going to need additional help. They rely more on traveler nurses or staffing agencies to provide support. And we know that the state can step in with some assistance in streamlining the process to bring out-of-state providers or retired providers to the table. So I think we'll continue to exercise those lessons. We'll continue to learn from them and streamline our processes. But I am eternally grateful to our healthcare partners, our public health partners, our emergency response partners who've come together through each of these surges to ensure that care in a hospital bed and trained professionals are available to provide care to people who need the care when they show up.
Thank you for that question. We do not have anyone else with their hand raised, so we'll just give it a minute more. Good opportunity. Dr. Sidelinger is a busy guy. He's here to answer your questions. So. And just a reminder for everyone that, again, we will be sending out a news release with this information as well as the link on YouTube of this media availability for folks. So I believe, Dr. Sidelinger, that was our last question.
Thank you. I want to say a thank you to all of you members of the media on this call for helping to continue to get the word out about a story that maybe doesn't seem to change much. But Oregonians really have risen up throughout this pandemic, have rolled up their sleeves and gotten vaccines. They've gotten COVID-19 boosters at levels, higher than most states, but still not where we want them. So helping us to remind individuals to get your flu shot, it's not too late. To get your COVID-19 booster, it's not too late. to think about the activities you engage in when respiratory viruses are circulating at a high rate. This is particularly true if you're at higher risk for disease, more severe disease. If you're older, have a chronic condition, if you're in a household with someone in those one of those conditions who is older, or if you have young children in your house, someone may be more vulnerable to disease. So wearing a mask when we're in indoor public places, thinking about changing our activity during the height of these surges, and being up to date with our vaccines are the best things that we can do. Have patience and grace if you need to seek care in our emergency departments or other healthcare settings where more patients are showing up and our providers are doing the best job they can to provide care to the most sick individuals. Our hospital partners are still experiencing really high volumes and are doing their best to provide high quality care to everyone, but the wait times may be longer and you may get your care in a chair in a hallway rather than in an individual room. So have some patience and grace with each other. As we move into 2023, the trends look much better, that we will not be having the same conversations and seeing the same heights of surges that we saw in previous years. And we can talk about some of the other ways that we can work together to keep each other healthy, to stay healthy throughout the year, and to enjoy a great 2023. So happy New Year for those who this is the first time I've talked to you this year, and enjoy the rest of this month. Things are looking better, and by the time we come together in February, I hope those trends will have continued and accelerated. Thank you.